Taoiseach, yesterday the waiting lists were published, and unfortunately it was like Groundhog Day all over again. 10 years ago there were 21,000 people on waiting lists for surgical and for medical treatments and day case or diagnostic treatments. Yesterday the list showed that there were 684,800 patients waiting on lists of varying degrees. Outpatients 494,530, inpatient day case 80,894, endoscopy active 19,300, inpatient day case 18,000, inpatient day case planned procedures 11,700, planned procedures for endoscopy 51,000, and endoscopy 8,294. And the reason I reference all those lists, Taoiseach, is simply nobody knows how many people are waiting anymore, because we consistently change the goalposts, we consistently change how we assess the numbers of people on waiting lists. We now have a situation where we have a thing called suspended lists. Suspended lists. So you're suspended from the list, you're in abeyance, and then you're brought back onto an active list at some stage. We now have a situation, Taoiseach, where we have people suffering with juvenile arthritis, scoliosis, and several other paediatric illnesses and diseases who are waiting inordinate periods for both inpatient or outpatient and inpatient procedures. It simply is wholly unacceptable. Taoiseach, we actually have a situation now where in the whole of England, in the NHS, there is 1,511 people waiting more than a year for an inpatient appointment. In Galway Hospital alone, there are 2,914. In Galway Hospital alone, there are 2,914 waiting more than a year for an inpatient appointment. So the fact of the matter is, Taoiseach, the health services are in crisis. Now, yesterday, if you wanted to get clarity on that, all you had to do was read the Minister's two press releases, both contradictory, one trying to correct the other in terms of targets achieved and targets missed, numbers that were seen and numbers that weren't seen. And there was corrections even in the context of the press releases sent out. And finally, Taoiseach, we now have a situation where there's advertisements going up for the winter ready and proofing of the health services for winter. One senior hospital manager told me that the only programme in place was the flu vaccine and prayers. The flu vaccine and prayers was how prepared we were for the winter initiative in some of our hospitals. So, Taoiseach, would you accept, I raised it a number of weeks ago, will you please accept that an awful lot has to be done in the context of the waiting list themselves, enhancing the capacity, making sure people are seen in a timely manner, but in the short and medium term, the issue of making sure that our hospitals can cope with what will be thrown at them this winter will be moved forward.
Dealing with these issues is a priority for the Government, and it's a priority for the Minister for Health, as every action he has taken supports that. The budget that is being given for the health service, the new initiatives, the increase in the funding for the National Treatment Purchase Fund, the £1 million per week that's now going to be extra, that's going to be spent on dealing with waiting lists shows that. The fact that the trend is downward. A lot of work to be done, nobody questions that. If you look at 4 hospitals where the lowest numbers on trolleys since 2006, Beaumont, Mayo, Cavan and Connolly, it's important to note this progress. There is a huge challenge, there's no question of that, given the demographics, giving people living longer, giving the demand on our health services, and as we develop more and more primary care centres, of course the demand continues in our hospital. It is on our hospitals. It is important to note that the home care packages, 45 extra a week, are going to help deal with these issues, because people will be able to get the services they need at home. The truth in relation to waiting lists is that the latest NTPF figures show that the number of patients waiting for a procedure has fallen by over 2,000 in the last month, and it is the 3rd month in a row the inpatient day case list has fallen. This is the category of patients who are actively waiting for treatment, and I think these reductions have to be seen as real progress. I accept your point that more needs to be done. We cannot relax one moment in relation to this because of the level of demand, but let's look at what is happening in relation to the trend being downward. There were significant decreases during October in both the 15 to 18-month waiting list, down over 1,000, and the over 18 months category, down over 1,000. For the second month in a row, there's also a decrease in the total number of patients waiting for an outpatient appointment. 788 fewer patients waiting for the outpatient appointment. Now, in relation to the point you make about the suspension of where patients were suspended because their doctors had decided they were unfit or unable to attend for clinical or personal social reasons, that is a reasonable thing to do because the people were not in a position to take up the appointments, and you asked for this yourself. In relation to the broader point you make about the accuracy of waiting lists and how we do waiting lists in this country as opposed to internationally, the Minister has accepted your point in relation to that, and Trinity College are doing a study on how waiting lists are compiled in this country, how it compares internationally, and we will have that information at the beginning of next year.
Evidence that our health services are in crisis, all you have to do is go over to the print shop in Oireachtas and see the number of Fine Gael ministers and TDs dispensing leaflets pointing out that you can get EU cross-border treatments and treatment abroad schemes. We now have a situation that Deputy Michael Collins from West Cork raised quite recently, where a 91-year-old man from West Cork had to go to Belfast for cataracts because he was waiting so long. 91 years of age, Taoiseach. So the fact of the matter is, even your own cabinet colleagues and TDs are running around the countryside dispensing leaflets advising people that the only way you can get treated is in another jurisdiction because of your failures. That's what's happening. So can we just accept for one moment that there are huge pressures on the health services, and all the spin has to stop, Taoiseach. It just has to stop, because we have people across the country waiting in ordinary periods in agony. Recently, a case was brought to me by Deputy Timmy Dooley, who sits next to me now, and a very elderly man waiting over 2 years for an appointment, even though it was marked urgent and he was in chronic pain for a hip replacement. Over 2 years. And every other deputy inside in this House could bring you instances of this as well, including your own. So we now accept that an awful lot more has to be done, other than the spin and the PR, other than moving the targets, extending the waiting times, as was done by Minister Harris's predecessor, who is now the Taoiseach. That's the reality of what's happening with Fine Gael's health policies at the present time. And your only answer seems to be to deliver leaflets to advise people how they can get treated outside of this jurisdiction.